Alright, so we left off yesterday talking about the digestive system, about what it's composed of and how it's supposed to work properly and all that other stuff. Now we're going to discuss the disease and abnormal conditions of the digestive system. So appendicitis, probably pretty familiar with this. Again, appendix was a little dangly hang off of the colon, and it's when that gets inflamed. Nobody really knows what the appendix was supposed to do. Research has shown that people who have their appendix removed very early on in life tend not to have a very good immune system compared to other people who have their appendix. But basically, it's just a little place for things to get trapped, which is what causes the appendicitis to begin with. So basically, it's a non-needed little dangly thing. So it's okay if it gets removed. Okay. Then we have cholecystitis, and this is inflammation of your gallbladder. So if anybody has ever had this problem before, it's extremely painful. Usually caused by gallstones. So remember, the gallbladder is the little guy that sits up underneath the liver, and it stores bile. And while it sits in there, it can harden and form these stones, and then the stones can get lodged to where the bile can't flow from the gallbladder into the small intestine. And when that happens, the gallbladder gets inflamed and you're in extreme pain. So they can take out gallstones, or they can just go ahead and take out your whole gallbladder. Again, it's not a needed organ. If you don't have a gallbladder, then your liver has to make bile on demand. So you may have to eat a little bit slower, kind of take things slower, maybe not as high of a fat diet, but other than that, you'd be fine without your gallbladder. Cirrhosis is where your liver is being destroyed. So something is irritating your liver. Can be a number of different reasons, and your liver cells are being damaged, and sometimes for whatever reason your liver is trying to keep up with the damage and trying to replace the tissue, but instead of replacing it with good tissue, it's replacing it with scar tissue, and therefore when it replaces it with scar tissue, it's not workable material. Like, it's not going to be able to do its job because it's scar tissue. It's not good liver tissue. Therefore, your liver is failing. Now, liver is something you cannot not have. Okay, so most of the time it's going to be caused by like drug and alcohol use, because again, your liver is what's going to detoxify your blood through there. So if you're a heavy drinker or a heavy drug user, your liver is going to have to do a lot of work, and it will cause damage to your liver and slowly start killing it until you have a non-working liver. And the only way to treat this is to get a liver transplant from somebody. Okay, it's not anything that you can reverse. Okay, constipation and diarrhea. Pretty sure everybody's familiar with this, but just in case not, constipation is where you have a decrease in bowel movements, usually due to dehydration, or can be medicines and stuff like that, but decrease in bowel movements. And then diarrhea is the opposite. So this is an increase in bowel movements. Too much water in the stool versus constipation, where there's not enough water in the stool. number of reasons why these could be caused: medications, illness, disease, whatever. Okay, diverticulitis. In your intestines, you have little pouches that are they're not holes in your intestines, but it's like little bitty like dimples inside your intestines. And I mean, some people have more than others. It's not going to hurt you if you have these little dimples throughout your intestines. What does hurt you is when food gets trapped in those, or some other particles get trapped in there. And if it sits there for too long, things start getting nasty, or it starts eating a hole through your intestine. That's when you have big problems. So it's going to be inflamed around all these little pockets of stuff. So these little pouches, again, by themselves, fine. But when they get food lodged in there, it can become inflamed, and that's going to be gross and nasty. Okay, gastroenteritis. So this is fancy term for like stomach bug. So this is when your stomach and intestines are kind of inflamed due to virus, bacteria, whatever. Doesn't usually last very long. But again, just fancy term. GERD, it's not GERD, but it's GERD. This stands for gastroesophageal reflux disease. Fancy term for heartburn. Okay, so this is where you have a little open and close valve at the top of your stomach. So when food passes from your esophagus to your stomach, it will open so that the food can drop from esophagus to stomach. But if you were to turn upside down, the contents of the stomach is not going to get back into the esophagus. Some people's little valve that opens and closes down there does not work very properly, and you do have stomach acid that comes back up the esophagus. Remember, inside the stomach, you have extreme acidic environment because it's trying to break down the food. And so when that gets into the esophagus, it's actually eating the tissue away, which is what causes all the pain of heartburn. Okay, so sometimes they have to fix the valve. Sometimes it's just a matter of taking medication that kind of neutralizes the acids to where it's not so painful if it was to get into the esophagus, things like that. Okay, hemorrhoids. We discussed these before, I think, when we talked about varicose veins. Again, varicose veins is when your veins, the valves in your veins start collapsing, and you get the wiggly, wormy looking things on the outside of your, be on like your legs and stuff. Hemorrhoids are varicose veins in a very specific location. This is around your bottom, towards your exit of your digestive tract. So it's specifically varicose veins there. Can be due to constipation and straining, could be due to increased pressure in the abdominal cavity, such as with pregnancy, things like that. But again, it's just a blood vessel that has kind of been pushed out from kind of up underneath the skin, and now it's kind of popped out a little bit. Okay. Hepatitis is inflammation of your liver, and it's caused by a virus. Now, there's hepatitis A, B, C, D, and E, and can be caused by contaminated food and water, can be bloodborne and body fluids, things like that, but it's virus that causes inflammation of your liver. Hernia is where An internal organ or vessel pushes through a weakened area